So let's get started. Next slide, please. I want to talk a little bit about the cloud. There's a book out by Tom Wolfe. I'm not sure if any of you have read it, but it was about 15 years ago. He came out with this book, and the concept was that the internet and the personal computer is going to change everything, and he was really right. What happened with those two products is it allowed people to work from anywhere. I know a lot of physicians are doing dictation, and that's being transcribed overseas and coming back to you over the night. A lot of x-rays are being read in the Eastern Bloc. And what really accelerated the process was the COVID virus. And because of COVID, a lot of people started getting used to working from home and doing things online, just like we are here. So the process of the internet, the personal computer, and now COVID has resulted in a lot of people working from home. And in fact, STI, we have a 30,000 square foot building in King of Prussia, and really the only people in there are receiving people, bringing products in. Everybody else is working from home on the internet, and we find that we haven't really missed a beat. So this is going to affect medical practices as well. I'm sure a lot of you have gotten involved in telehealth or having your staff work from home. But of course, in medicine, we have to be at the office to see people personally. But a lot of the things that we used to do in the office can be done from home. Next slide, please. I want to talk about a couple new products that are out from STI before Julie gets started. And the first one is ChartMaker Go, which is our cloud version of the software you're using now on your server. So I'm not sure if a lot of you know about this, but you can also now use this product instead of the one that you are using. And what it does is it eliminates the need for you to have a server in your office. And what happens is we can move your data into the cloud, and STI does the actual program loading and automatic backup off-site, and your people access the software via the internet. It's exactly the same software that you're currently using. The only difference is who hosts the data. And the advantages typically are you don't have to worry about buying servers, and if we get an event like, if anybody remembers Sandy, where we're wiping out sections of New Jersey and New York, you can still operate because the servers have redundancy and they're somewhere else. So as long as your internet is working, you can access your data. The other product that we've come out with is a product we call Revenue Cycle Optimization. In fact, we're having a webinar about that on October 20th, and that's a process in which STI assists in the actual billing process. We got involved in that when a lot of our companies' product clients couldn't find billers, and we have partners that will help you with the billing. We also have a new smartphone application which allows charge capture if you're a hospital-based doctor and you're seeing patients in a hospital or nursing home. This product allows you to capture charges on your phone, and they get sent right to your billing application. MIPS Assistance Program is designed for those practices doing Medicare that want to get the most points and the most revenue from MIPS, and we have that. We also came out this year with a new telemedicine software and electronic faxing to eliminate the old fax machine in your office. We have a patient reminder and recall product that allows you to send text messages to your patients to remind them that they're due for a patient visit or to bring them in with a recall. They have, if you have your flu shot vaccines in, you can recall patients that come in for that. People don't know we also help with cloud and phone and data. And a lot of our practices now are using the same internet that they're using for their cloud version for your telephones, and it reduces the cost of phones. Probably the biggest thing changing this year and next is going to be the 21st Century Cures Act, which is going to require practices to provide via a patient portal patients' medical chart information if they request it. And that's a new requirement that's starting in 2021. Finally, we have e-prescribing software available. Newest thing we have is a patient payment online where your patients can actually pay their bill online. And of course, we have managed services through our IT division, and also that helps with ransomware. So that's what we have. It's new. Let me now turn this over to Julie Soll, who's going to talk about the ERA process, new programming we have. And I'll be back at 9:30 to go through questions. So once again, thank you for attending. It's all yours, Julie.
Thanks, Joe. Good morning. My name is Julie Soll, and I am part of the support team here at STI. And yes, I'm the one who's going to go over this great new ERA feature. And so, you know, the question may be why? Why did we decide to bring something like this on? And it's just we've heard from clients and even from our own RCM division as to how many times EOBs are accessed during the day. I mean, we did our own, let's say, sort of little in-house testing, and they, you know, just the team itself was accessing EOBs probably like 200 times across their team over just 2 days. So we were looking for something to make your lives easier, to make it easier for your teams to be more efficient in what they're doing, and to help your business and your patients that much better. So what are the benefits? The benefits are that it links the EOBs to the payments in Enquire, so that you'll no longer have to search for EOBs. You know, a lot of people use either Easy Print or something like that to look for their EOBs. So you would just go, you can go right into Practice Manager to do that, so you don't need to go searching for EOBs. We wanted obviously easy access to your EOBs. You know, like I said, just click, a click of a button. We're hoping for, like I said, to make your staff's lives easier, faster turnaround for patient inquiries. So if the patient has the EOB in their hand and they're calling you for questions, you can click on that button and be on the exact same page so they can understand what their balance is, what they owe. And also better efficiency in handling insurance inquiries. So, many times I know that, we try to encourage people to send their secondaries electronically, but we know that there are some holdouts and that there are some times that you need to actually print EOBs for insurance companies. And also it's a great way to just, make sure you're getting paid correctly. So it's just to make your, insurance inquiries and documentation that much easier. So that's to make your life more efficient. So how does this happen? So the process is that your billing people have to import the file and then post the check. So I'm going to go over that process. So step one is that you are going to, your billing person is going to import the remittance file. So you will be on your remittance tab, you'll select your correct remittance type, and it doesn't matter which they select. It could be Medicare, NEIC, any of them. You'll click the button and click import. So you've imported your file. And then the second part of this is posting. So in this instance, we are posting the payment automatically. They are on the remittance tab. You've clicked on post remittance payments, selected your check, and then they would click this post file button, and then it would post your payment. So then the result of that is that it automatically populates. So what needs to happen is that you import the file, and then the ICN, what's the ICN, the internal control number from that claim, needs to be attached to the payment. So in this example, so this is an auto post payment. It automatically populates the ICN from this control number here on your EOB, populates the control number field in Practice Manager. You would go into your payment tab, review payments, in the control number field, and you will see that that is where that control number, that ICN is populated. And even though you don't see all of the digits, I can promise you they are all there. So that's how you auto post a payment. And then if you were to manual post, so say, you went through the auto posting process, so you post the payment there, and then you're going to move to Inquire. So you're like, how do I access that EOB? You're going to select the payment in Inquire. Under Payments, you've selected it. The ERA button will now be lit. So then you will click the ERA button, and then you'll see the original EOB. And so what we have included in this, as you see, explanation of benefits, you have your heading, your provider information, your file name, name of the, insured, all the pertinent information that you need, you can print right off here. You'll have and also you have your glossary down here. So all of the information that you would normally need to send to an insurance company is included in this view. And it's that's the great thing about it. So that's the auto-posted version of this. And now we're going to move to the manual posting of this. So the steps are still, the step that is always going to be the same is the importing of the file. You will always have to import the file. So if you know that you have a $0 payment file and you are going to post those manually, you will still need to import them using one of the remittance types, Medicare, NAIC, whatever's your flavor. You will have to come to the remittance, select your file, and import it in order for it to be part of Practice Manager and for this process. So you've imported the file. Now we're going to be posting this payment manually and thinking, okay, so in this instance, your billers probably come to the payment tab. You've selected your payment to post. And in this instance, you'll post your payment just like you always would, but in this instance, you will need to enter that control number. So whatever control number is listed here will also need to be entered here. And like I said, just because it doesn't display everything doesn't mean, you'll have that rollover of numbers. They will still be in there. Can promise you that. So that's entered into the control number field. And then here we are back in Inquire. So in this instance, you would select your payment. You're going to select your ERA button. And here you go. Here's your, here is the payment, the ERA, the same deal, but how you get there is, is just a little different. So that the keys are importing and ICN. If there's nothing else you take out of this, it's the importing and the ICN. So you see all of your information, you see your same thing, the name of the practice, your insurance, your payment, your glossary is included at the bottom of this. So everything that will, that you would, need to refer back to is included by, clicking, going to Inquire. You won't have to go to, well, for your older checks, you will have to go to EasyPrint, and we'll talk about tidbits after this. So here are some tidbits of this. So the tidbits of this are, it was introduced in ChartMaker Medical Suite 655.550. So that was the first instance of this. And then we updated it in version 656.450. So if you haven't updated yet, this 656.450 also includes the latest ICD-10. So it's a great twofer. You're going to, I guess, improve your insurance experience. You'll get your latest ICD-10 codes, and you'll get the latest version of this ERA feature. So that's a great thing. One thing you will need to know is that this applies to newly imported EOBs only. So this is not retroactive. So you will have to still keep EasyPrint or however you normally access your older EOBs. That will still come into play, but for new EOBs, they'll be in there. As I said, the tidbit, your internal control number on the payment must match the ICN in the imported file. So whatever number is on that imported file must match the ICN, and as you saw, that can be done automatically if you auto post, or it can be done manually. If you have to manually post something, if something, for some reason doesn't match, or you'll have to manually, there's manual intervention, there's still a way to get that ICN attached so that you will still have access to that EOB. And as we said, users can post the checks automatically or manually. So those are, that's part of it. But just hoping this feature will make your lives easier and much more efficient and save you time, looking for anything that's new. Like I said, unfortunately, we can't do anything with the old stuff, but going forward, this is a great, great tool for you in your office. And if you have any questions, or if your team has any issues or needs assistance, please feel free to contact the Practice Manager support line. We are here to help you walk through this. And like I said, I hope you guys really enjoy it. It's definitely, I've heard good things from people. Some of the people who've already been using it have said that it's been a game changer for them, because it's a lot less looking for them, a lot less time. And if you have to, if we talked about the 200 times that we did our own, when we did our own in-house study, going to just one-stop shop under Inquire, the payments tab, that's great. So now I'm going to turn this back over to Joe and to whomever for any questions that you may have.
Thank you, Julie. Chris, do we have anybody have any questions that we'd like to discuss?
There is one, Joe. Can the
Go ahead.
ICN number be listed on the unposted report to add when need to manually post, so these appear in the manual position? I'm sorry, manual posting.
So I think what they're asking is, I believe what you're asking is, though, say they're so this is an unposted, so they've imported and they are on the unposted payment report, correct? I think that's what they're asking. The ICN, unfortunately, is not listed on that unposted payment report. So I'm trying to, so yeah, she would probably have to, yeah, that could be a little tricky. Yes, if it's on the unposted payments. I'm not sure where that is, but you know what? I can definitely look that. I'm saying we can figure out a way to get that done. And if they wanted to contact me, we could, look for a way around that, if it's on the unposted.
Okay, thank you. I don't see any other questions, Joe.
We'll give them a minute or two to think of what they want to ask. Upcoming webinars, let's talk about that for a second. We've started doing these user group webinars about once a month, and the next one's scheduled for October 27th. What we try to do is pick one topic that we can discuss quickly within a half-hour time frame, so we're not taking a lot of your day. As everybody probably remembers, we used to have user group meetings throughout the area, but the problem was we had to go to an area that had enough people that would attend, like Syracuse or Cherry Hill or King of Prussia. And the people that were in the outlying areas didn't get a chance to attend those. With this web cloud version of a user group meeting, I'm not sure if you know, we have over 90 people signed up for today from all over the country. So once again, I'll put a pitch in there for the cloud. If you're not using the cloud, you really want to think about it. We're also having a webinar on 10/20 and 11/17 about revenue cycle optimization. And we're also getting involved with medical and surgical centers. And we have a webinar for them on October 6th and November 3rd. My email is on top. If you have a question you want to get to, and Julie's as well, so if you want to get to us with a question, feel free to do that. And we'll give you one more chance on questions. Anything else, Chris?
Yes, there is another question here. In your examples, you're showing a Medicare EOB, and there are usually many patients on the EOB. You're showing on the Inquirer only one patient. Are you actually capturing each separate patient for view?
Yes. So, so what happens is that it is one per patient. So when we import that ICN is individual to each claim. So you will only see the information for for the one claim. So yes, normally you would have multiple patients that you would post that for, but each one has their own individual ICN, and those individual ICNs will be captured in Practice Manager. And so when you look, at that EOB example, you will just see the one patient. So we have something similar to that, I think, in the response viewer. If you were to choose, I think, under like one claim, it's the same thing where you would just choose out of, if you have a, whole EOB, you could select one and view the one patient. So it's the same view. You're just going to see one patient's EOB. You won't see you won't see it in its entirety.
Okay, I have another question. Is there the ability to upload manual/mail in EOBs?
Upload / upload the mailed EOBs. That I don't see how that would happen, because you need to be able to import those. So unfortunately, if they are mailed, because what it is we use the 835 that comes from the insurance companies. We use that as our as sort of our formatting for how we display the information. So that's why it's important to import regardless of how you're posting, whether it's auto posting or manually posting. I can't think of how that could be done without that original import of the file.
Julie, here's another question. Will we be seeing the entire EOB under the Inquire tab?
No, you will just see the individual claim, just the one person's part of the EOB. You won't see the whole EOB from start to finish. No.
Okay. Once the remit is electronically posted, can you still delete the EOB file from the Post Remit tab?
Yes, absolutely. Yep, you can absolutely do that. We're storing the information from that ERA file in a completely different folder. So you are free to feel free to delete. That's all I can say, to keep it clean in there. Absolutely.
Okay. Where do you find the ICN if unposted?
I think that was the other question they had asked, like if it's an unposted payment. So you would have to somehow access that original EOB. Usually a copy of the original EOB is saved in, like we're saving a copy of it in the PR imported folder. So, I mean, there is a way to access the original EOB, but it would definitely be, we'd have to make a shortcut to the PR imported folder to get access to the unposted ICNs.
All right, here's another question. Can we import a PDF remit to be able to do this?
No. Nope, unfortunately, that like the 835 file is within the ANSI 5010 format, and so that's what we use. We don't have the ability, let's say at this time, to import PDFs, but I can always bring it back to the people.
Okay, here's another question. So they can be posted auto posted, or manually, as long as the EOB is imported. Or another way to say this, can a manually posted payment that was not imported, but does include, does include the ICN control number still work?
If it has, if I'm understanding the question is, you're asking if an unposted or unimported payment can be matched. It sort of needs to be linked to something that's been imported. So without the original importation of the file, there's nothing for that ICN to sort of grab onto and link to within the database.
Okay. Can we auto post the DALIS payment?
Yes. Yeah. So, I mean, I happen to show a Medicare example, but NEIC, I think Fidelis falls under NEIC. So yes, you can absolutely, if it's an 835 format and if you're downloading it, even if you're downloading it from, I think either PaySpan or some other way that as long as it's in an 835 format, we can't do PDFs, but if it's in an 835 format, we can absolutely help you import and post those. And like I said, just because I happen to show Medicare doesn't mean, I think we have Blue Shields, we have CDPHP, we have Independent Health, so whatever remittance type you're using, it works for all of them. I just happen to use Medicare as my example.
Okay. Here's a question. How do you know what version you're on?
So you would go in the upper right-hand corner of your Practice Manager, and you're going to go to Help, and then About Practice Manager, and it should show you right in there what version you're on.
Is there any way to scan paper EOBs into the system to access and put in ICN manually in the system?
Not yet.
Is it showing the entire EOB or just one claim line?
It's just showing just the one claim line. Actually, I will, in that instance, let me bring it back to you, is if they have multiple line items and it's all part of the same ICN, it will show all 3 line items or 4 line items. I just happen to use a 1 line item example, but if they have, 5, 6, however many procedure codes, if they're all listed under one ICN, that will be viewed. I just want to make sure that's clear.
Here's a question. Can we access this webinar for future reference? We are recording the webinar and it will be on our website. Here's one more. Is there, excuse me, is this only for the EOBs that come in from Change Healthcare /NEIC? I assume I can't do anything with the checks and EOBs we receive by mail.
So, yep. So, yes. So the ones that you receive by mail, unfortunately, like I said, I'm going to bring it back, like I said, to the developers regarding the PDF version of this. But yes, the ones that come through Change Healthcare are what this is designed for. But as I recommended, I think some people get some from PaySpan or they get them from Instamed. I mean, as long as it's an 835 format, it can be imported. Whatever you're importing now, even though it doesn't say Change Healthcare, if you're importing it and posting it, yes, it will be linked. It can be linked.
We do not import all ERAs to post due to the fact that we're out of network with some insurances and it takes an automatic write-off when posted. How would this work for us? Well, what you could do is you could just import them. So if posting doesn't work for you, I would still recommend, obviously number one, I would say probably make a copy of that before you import it because as the billers that are on the line know that as soon as you import that file, it goes away. So if you know that you're going to have to manually post that anyway, make a copy of it, somewhere else and definitely import it. So as long as it's imported,
you can, we have shown, you can absolutely enter in that ICN manually.
Okay. If you're on the correct version, is this automatically a feature?
Yes. Isn't that good news? You might even have it and you don't even know it. Isn't that great? Surprise!
What about all the EOBs that are not in downloaded files?
Yeah, so unfortunately, the ones that weren't included, you'll have to just refer back to, I'll say, your old filing system, whatever you normally do to access. Like as we said, so this is kind of this is a going forward product, so or feature. So anything prior to, you know, the 655, you will have to access however you normally have been accessing EOBs.
Is there an additional cost for using this feature?
Nope.
Can you do a search in reports for the ICN number?
That's a good question. I honestly don't know. And I'd have to get into Practice Manager to do that, and I know they don't want us to show me that. So I don't think you can search by ICN. I'll be honest. I can't imagine that we can, but I will check it anyway.
Okay. And I think that's it.
Well, let me be a broken record and reiterate. People are asking about what version they're on. Once again, if you're on the cloud version, in which STI is hosting the servers for you, STI is updating your software versions automatically for you. So that takes that function away from the office and puts it on STI's responsibility. And we're also doing backup, which is critical, and off-site backup. Recently, we had a 3-physician pediatric practice that was hit with a ransomware attack, and it locked up their data. We went to restore their backup, and their backup was like 6 months old. They weren't doing their backups. And the result was all that information was gone, including immunization records. So I will tell you, one of the biggest advantages to being on the cloud is you're out of the office sooner because STI is doing the program loads and the backups for you, so you're always on the most current version of the software. So you don't need to switch to the cloud version now, but I always tell people if you need to replace your server, it's a good time to take a look at the cloud because it may be less expensive and not to have to buy a new server and to move to the cloud, because there are some costs to moving, but I think in the long run they're a lot less expensive, especially when you look at the amount of time you're saving by having STI do a lot of these functions for you. So any more questions? Chris, are we clear?
I think we're in good shape, Joe.
All right, right on time. Well, thank you everybody for attending. Thank you, Julie, for doing this. Thank you, Chris, for moderating. And don't forget the next user group meeting is going to be on October 27th. So have a good day, everybody. Thank you.